Good evening, ma'am. My name is Melvin G. Ampalid, and tonight I'm going to tackle about the topic that you have given. So first, letter A is hospice and home care. Letter B is community-based services. Letter C is assisted living. And letter D is special care unit. And the last one is geriatric unit. So let's start first with hospice and home care. So, hospice in home care. So, hospice care is a type of a health care that focuses on the uh, palliation of terminally ill patients' pain symptoms and attending to other emotional and spiritual needs at the end of life. Hospice care prioritizes comfort and quality of life by reducing pain and suffering. Hospice care is provided when there is no active or curative treatment being given for the serious illness, and treatment during hospice care involves provide while the patient is receiving active treatment. Patient is eligible for hospice care if they likely have 6 months or less to live. Next is home care. Home care is a health care or supportive care provided by a professional caregiver or nurse in the individual home where the patient or client is living. As opposed to care provided in group accommodation like homes, home care is a healthcare provide services that are brought to patients who require intermittent skilled nursing care, physical therapy, speech language pathology services, or continued occupational service. As prescribed by the doctor, the patient progress must be recorded. Next is community-based services. It is refers to a philosophical approach in which communities have an active role and participate in highlighting and addressing issues that matter to them. This challenges community members to identify what the issues are and to work together to address those issues. Letter C is assisted living. So it is a residence or assisted living facility is a housing facility for all people with disabilities or for adults who cannot to live independently. So letter D is a special care unit. A special care unit for the um, from the regular intensive care unit. Nurse, ca- nurse case management, it is the care delivery system with medical care delivered by one attending pulmonologist. Patients are transferred to the ECU following a 5-day stay in the ICU and remain in the ECU until discharge. It is acknowledges that aggressive use of sophisticated technologies is not sufficient to restore an acceptable quality of health to patients who have experienced prolonged periods of critical illness. Instead, it is important to alter the environment to provide a more balanced approach tending to social and emotional needs and explicitly reevaluate goals of care. The program addresses physical care needs of critical ill care. The program addresses physical care, addressing coping, depression, and life satisfaction after critical illness. The goal of special care unit is to continue to provide needed technologic interventions while also allowing nurses to focus on patients' emotional, social needs, and family needs through the use of nurse-managed special care unit as a companion to ICU. Lastly is geriatric units. Intensive care unit is a special intensive care dedicated to a management of critical ill elderly. A geriatric patient, an older person with impaired overall function. There is no set age, but he or she is usually more than 75 years old with chronic illnesses. Physical impairment and or cognitive impairment. Older adults with frailty may also struggle with the following: gait abnormalities and recurrent falls. So that's all tonight. Thank you for listening.